Across Lancashire and South Cumbria, we have a transformation programme that's underway. It's all about how we are going to bring about change in the way we deliver services, bring those services closer to patients' homes or in the communities where those people live. And technology plays an important part in that transformational change. In Lancashire and South Cumbria, we've agreed a strategy that has 5 core elements within it. All the central theme is all about how we share information and share records across all the different organisations who provide health and social care in the region. That also includes for us organisations such as charities and independent healthcare providers. In addition to the sharing of records built around that, we've got a programme of work for that allows people to access their healthcare record, to use new online services, to help patients navigate what is a quite complicated healthcare and social care system. We're also keen to use technology in new and exciting ways, to use technology that allows patients and people to stay in their own homes, to manage chronic conditions such as breathing problems or mental health issues. They could use technologies to remotely access services when and where they need them. They could use technology to monitor them in their own home, to make sure if they have problems, a trip up, or there's something like that they need support. That technology will make the healthcare system aware that they need support. We're also very keen to use our data. We have lots and lots of data. We collect an enormous amount of data in health and social care. What we tend not to do very much is use that data in all sorts of intriguing, exciting ways. So we've got a programme called a Learning Healthcare System, which is about how we use that data, how we can analyse that data to predict those people most likely to come into hospital and intervene to help them not have to come into hospital. And then the final area is all around technology and technology to allow people, our workforce, to work across organisational boundaries, to be able to use Wi-Fi wherever they need to access records and other information that they need to provide care in patients' homes. What we're doing at the moment is we're still very much in a planning phase. There's a whole programme of activities that are not technically related, but technical elements to them. How we were configuring services that sit outside hospital, how can we create more capacity in primary care. So there's a whole raft of activities that are going on, and the digital element needs to respond to that. But in preparation for that change that we're on the plans that we're developing, we're working on enabling technologies, things that we know are going to be needed no matter what the future service provision looks like. So we're doing information sharing. We have a project called the Lancashire Person Record Exchange, and this allows information that's collected by one doctor to be shared to another doctor in another organisation or to the community nurse or even the GP, and it moves information around the system seamlessly and into the clinical systems that people are using. In the same, if you're a patient going into one organisation, seeing a hospital consultant, and then you go back to see your GP, the information that was collected when you were in hospital is now available to you in that GP practice in a timely fashion. We're also exploring a web portal, a mechanism for patients to use apps and help staff prescribe apps. It's a product called Orcha. You can see it online if you go to orcha.co.uk, and that's really a vehicle for us to test how apps are being used. So lots and lots of patients are using apps now, but not particularly in a coordinated or orchestrated way. And what we're doing with that portal is linking those apps so that the data flows from an app to the hospital system. Right now, we are exchanging around 3,000 documents a day between hospitals and GPs, and it's growing exponentially. And we've already had stories from GPs about people who've been into hospital in the morning, come back and are seeing their GP in the afternoon, and the information's there. So although patients may not actually see that, the GP or whoever's looking after them will. In terms of the apps and things like that, there are examples already out there, such as How Are We Today, from a company called Intellisant. That's That's being used by patients who are being treated by Lancashire Care, NHS Foundation Trust. So there are visible signs right here and now.